All right, some major changes for Medicare in California for 2026. We just got out of the government shutdown, so I felt like I was inclined to make this video to make sure everybody is in the loop as to what happened. So as of November 14th of 2025, Social Security decided to increase initially the premiums for 2026 to $206 for the Part B premium. And guess what? As of November 14th of 2025, the premiums have gone down and so have the deductibles. So it's going to be at $203 for the Part B premium. And also the annual Part B deductible has gone down from 288. That was the announcement before the shutdown. And now after the shutdown, the deductible is going to be at 283 for Part B. Now, it's not going to make the most difference in terms of day-to-day living with these price changes, but at the very least they're doing something. So just wanted to keep you guys up to date as to what's happening. So even with Part D, there's going to be a out-of-pocket maximum cost at $2,100. So this is different from 2025, which the cap was at $2,000. And again, the first round of Medicare negotiated drug pricing for medications like Xarelto and some of these diabetic medications and high cost medications, and for the most part diabetic medications are high cost. This will take an effect for 2026. Now in California specifically, here's some things that have been going on, and just on the ground level here from what I've been seeing, carriers like United Healthcare, Aetna, and generally these PPO carriers have changed networks, and a lot have been pulling out of major hospital groups. So they're going to discontinue certain PPO Medicare plans. And if you are on a PPO Medicare Advantage plan, especially with United Healthcare or Aetna, you understand exactly what's happening. And this is the reason why people are reshopping for Medicare Advantage plans. This means that beneficiaries that had a PPO with Medicare Advantage, you very much have to verify with the carrier to see that the medical groups that you guys are in are still intact for beneficiaries and the doctors are still accepting them. Of course, a lot of people are considering HMO options. Some people are even trying to pass underwriting to go into a Medicare supplement plan from what I've been seeing. And of course, that's based off of health. So it has been that kind of year where people had to make the decision to say, hey, okay, let me think about an HMO this year, or fingers crossed, I might qualify for the health underwriting that Medicare makes beneficiaries go through if considering a Medicare supplement. So just going back to what's happening with United Healthcare, so a lot has been impacted. It's confirmed that some service areas, and I'm talking about full counties, are losing United Healthcare PPO policies effective January 1st of 2026. Providence being one of them, Cedars-Sinai being one of them, Hogue being one of them. And this is all across California: Los Angeles, Orange County, San Bernardino County, Ventura County, Humboldt County, Napa County, Sonoma County, Yolo County. A lot of these carriers will no longer offer these plans. And nationally, there's been an exit. 109 counties have exited, and this is leaving a gap of 180,000 members without any type of insurance for 2026. So a lot of scrambling going on here. So just wanted to let everybody know what exactly is happening with this situation. This has come up a lot in my office and definitely needs to be addressed, especially if we're making decisions for 2026. Now, the networks and benefits are critical now, okay? So because of these carrier shifts, we have to ask ourselves, are my doctors still in network? Which carriers are going to accept them? Do I have to belong to a medical group coming out of a PPO? And that answer is yes. If you're going to an HMO, if you're going to a Medicare supplement, 97% of doctors will take a Medicare supplement plan or original Medicare, except for Kaiser being one of them. So it's very important to check with an agent like myself to make sure that these plans, outside of these PPO plans that have dropped off, Aetna being another one, are still going to be a network. And if you're considering an HMO, again, please review the medical groups your doctors are in. If they're not, it's also a year of decision making. It's just what it is, of whether or not we're going to keep those doctors or not. And it's a hard decision to make, but a lot of people just have to bite the bullet, just because if they don't qualify for a Medicare supplement, this is just what we have to do. It is just that kind of year. So again, what this means for seniors is there could be higher premiums, especially on the Medicare supplement side, because right now they are self-correcting itself in terms of premiums. And also with Part D, there's been a lot of changes with Part D as well too, in terms of the premiums going up. The deductible for Part D is going to go from $590 to $615 for 2026. So there's going to be that change as well too. So just don't assume that your 2025 plan is going to be the same for 2026. And if you're in 2026 and you're looking to review policies even during the open enrollment period. So again, the annual election period is when you can switch from a Medicare Advantage to a prescription drug plan, or a Medicare Advantage plan to another Medicare Advantage plan, or a prescription drug plan to another prescription drug plan. That's the annual election period, which is October 15th to December 7th. Now, there also is the open enrollment period, which you can make a one-time switch from January 1st to March 31st from a Medicare Advantage plan to another Medicare Advantage plan one time. This was designed for people that made the wrong decision or got switched over unknowingly through some call center or some agency that just wasn't doing the right thing for their clients. Then at that point, the client has the right to switch over one time during that period. So I felt like it was important to say that too, because I found out that a lot of people do not know about that period. So that's January 1st to March 31st. And that's every single year that this happens. Of course, if you're on Medi-Cal, now you can switch over once a month from Medicare Advantage plans. For example, if you're on a dual policy with Medicare Advantage and also with Medi-Cal, also known as Medicaid nationwide, then you can switch over once a month. Now, please, I urge you, especially for 2026, please consult an agent like myself. And again, we're brokers, agents. The wording is sort of interchangeable. Some agents are specifically captive to one carrier, so they're going to only quote one carrier, where brokers like myself can quote multiple carriers. So get with a broker, actually. Let me emphasize that. Get with a broker to ensure that your plans are going to stay intact, your medications are still going to be at a good amount, and your copays are going to be at a good amount where it's affordable for you. So I felt like I just needed to quickly make this video here for everybody that needs. And if you have any questions, feel free to reach out at 323-844-8471 so we can help you out with your California-based Medicare plans. And if you have any questions, another source of contact is Andrew@healthmutualnetwork.com. Please please subscribe to this video, and I'm going to give you some more content here while I get information in real time. Thanks for watching.